Statins are a great group of medications that have been available to us since about the 1980s. They work by inhibiting an enzyme in your liver called HMG-CoA reductase, and by inhibiting that enzyme, they prevent the production of cholesterol. Even though statins are a great group of medications, they don't work for everyone. One reason that they may not work is because we may see some reduction in cholesterol, but not enough. Another reason statins may not work is because patients can have side effects. The most common side effect that we hear about is muscle aches and pains. And the last thing we worry about with statins are that they can actually cause liver damage because that's where they're metabolized in the body. If statins aren't tolerated, there are several different medication options that are available to patients. All of these medications either work by preventing production of cholesterol in the liver or by preventing the uptake of cholesterol in the gut. These other agents may be better tolerated by patients because they usually don't have the same side effects of the muscle aches and pains, and also some of them are not metabolized in the liver, so they don't have that same effect of causing liver damage. PCSK9 inhibitors are a new class of medications that may be available to patients to help reduce their cholesterol. They're a new and novel type of agent. They're actually a monoclonal antibody that works by inhibiting a protein in the liver that's responsible for the production of cholesterol. The latest data that we have on this group of agents comes to us from 3 trials that were recently published in the New England Journal of Medicine. So in these 3 trials, everyone received a statin, but half the group received a placebo drug and the other half received the PCSK9 inhibitors. And what we found is that patients that received the PCSK9 inhibitors actually had a significant reduction in their total cholesterol and specifically their LDL, which is oftentimes referred to as someone's bad cholesterol. In fact, these studies showed about a 60% reduction in LDL cholesterol. As with all medications, there are some downsides. One of the most common side effects that patients complained of when receiving these medications were neurocognitive. So things like having difficulty concentrating or just feeling like their mind was a little bit fuzzy. Also, these medications are only available as an injection. They have to be given every 2 to 4 weeks, and you have to go to your doctor's office to receive them. And the last thing that may particularly hit home for a lot of Americans is that these medications are expensive. Currently, the estimated cost for a year's worth of treatment with PCSK9 inhibitors is somewhere between $7,000 to $12,000 a year. While we do have good data that shows us that PCSK9 inhibitors can lower cholesterol, the next question that researchers have to answer is whether or not this reduction in total cholesterol and LDL actually translates into lower rates of heart attacks, death, and stroke. We have that data on statins. The question is it going to be the same for PCSK9 inhibitors? Patients always ask me, is there something else that I can do besides take a drug? And I always say, yes, the first thing you can do is diet and exercise. That is the cornerstone of everything that we do. I don't think a medication is all